We just heard one person's story of how having a stroke impacted her life and the importance of being proactive to help reduce your risk. Dr. Donald Heck with Cone Health Neurosurgery at Greensboro is here to talk all about strokes and what you need to know. First off, Dr. Heck, thank you so much for joining us.
Oh, you're welcome. It's really good to be here.
Yeah, an important conversation too. To start here, who's at risk for strokes?
Well, wouldn't it be nice if it was only old people and sick people, right? I mean, we know that strokes are more common as we get older, but the truth is that I'm at risk for having a stroke, and so are you. Strokes affect people of all ages, young people, old people, people in the middle, people who are very healthy, and people who aren't. And actually, sometimes it's hard for doctors to make a diagnosis of a stroke in a young patient because it's not what we think about. But the truth is that we're all at risk for having a stroke.
And what are the symptoms and signs?
So the most common symptoms would be drooping of the face or sudden weakness of one arm or the other, or sudden difficulty speaking or understanding what other people are saying. Other symptoms would be a sudden difficulty with balance, or a sudden inability to see, to say one side of your body, or to see out of one eye. There is an acronym for this. It's called B-FAST. It stands for B stands for balance, E stands for eyes or a visual loss. The F stands for facial weakness. The A stands for the arm. The S stands for speech or language problems. And the T, which is maybe the most important one, stands for time to call 911, because there are effective treatments for stroke, both medical treatments where we administer medicines and certain types of surgeries. But all of those treatments are very dependent on getting them done early. So it's important that people know to call 911 and to seek immediate attention.
And could patients experience, or people, could they experience those symptoms, at the same time, like one or two, or does it just, one symptom happen? How does that work?
Yeah, that's a great question. Yeah, so oftentimes more than one symptom is present at the same time. So the larger the stroke, the more symptoms are going to be present. So, for example, a major stroke in the left side of the brain might present with an inability to talk and also an inability to move the right side of the body. So, when more than one symptom are present, that increases the likelihood that we are dealing with a stroke, and also usually indicates that the stroke may be larger, in which case the immediate treatment is even more important.
Sure. Are there health issues people should be aware of that may increase their risk of having a stroke?
Yeah, there sure are. So the good news is that they're the same health issues that increase your risk for having a heart attack. So we know that smoking is a major risk. So we need to stop smoking if we smoke. And then other medical conditions like high blood pressure, diabetes, high cholesterol, these need to be treated in order to lower our risk of having a stroke or a heart attack. And then the other would be family history or genetics, but we can't do a lot about the genes that we inherited from our parents, but we can do things about our blood pressure and our cholesterol and our diabetes if we have it, to make sure that those things are really well taken care of. And that lowers our risk of having a stroke, but also lowers our risk of having a heart attack.
Sure. And what does someone with a family history of stroke need to be aware of?
Yeah, and as we talked about, you can't do a whole lot about what your parents gave you in terms of your genes, but if you have a strong family history of strokes and heart attacks, it's even more important to be on top of your health and being on top of your blood pressure and on top of your cholesterol, your diabetes if you have it, to not smoke, and to get a moderate amount of exercise and to eat a healthy diet. All of these things are important, not just for lowering your risk of having a stroke, but also for lowering your risk of having heart attack, cancer, and truthfully, if you take good care of yourself, you're going to feel better. So it's they need to do those things even more so than everyone else if you have a strong family history of stroke or heart attack.
All right, well, we're going to pause the conversation here because we have a question where we want to talk about some of the steps we need to be taking to help lower our risk for stroke. But again, we are here to spread awareness, to talk all about stroke. So again, we'll continue this conversation right here after the break.